So pancreatic cancer is a type of cancer which affects your pancreas, which is an organ that sits in the middle of your tummy towards the top, and it's abnormal growth of those cells, which then goes on to cause cancer, and it can cause a vague number of symptoms, some of which people don't necessarily recognise early enough, and it can be quite difficult to diagnose. So it's really important to be aware of those symptoms. So number one, I would say tummy pains. So tummy pains tends to be up here. We call that the epigastrium, but it can also be at the back. Some people report that it feels like the pain's going boring into the back. So I wouldn't ignore any pains like that. And if you've got a new onset of back pain, which you don't really think fits with kind of pulling muscle at the gym or bending over to pick up a toolbox, etc., then always go get that checked out. So it's not like other cancers where, you wee blood, you think cancer, you have a cough for a month, you think cancer, etc., which is all those adverts are about. Pancreatic cancer is a lot more general and vague than that. So other symptoms other than pain would be weight loss. So we would always take weight loss seriously if you haven't tried to lose weight through a diet. And the other thing is if your skin starts to go yellow, so we call that jaundice. And the mixture of all those symptoms, as I said earlier, can be related to other conditions as well. So that's why pancreatic cancer is so difficult to diagnose, because it presents so late, so the symptoms kind of grumble on for a good period of time, and it tends to be diagnosed too late in order for us to be able to do something to treat it and cure it. But I think the most important thing to get across is not everyone with the symptoms I mentioned above would have pancreatic cancer, and they're a mixture of common symptoms that in the majority of people will be related to mild or non-severe disease, really. I would also say it's worthwhile consulting with your own clinician. That might be a GP, it might be a nurse practitioner, about those symptoms, and then we can take responsibility for that. We can pull all those symptoms together and try and find out a bit more about them. Is it simple indigestion, or is it indigestion, a bit of back pain, a bit of weight loss over the last year? Actually, which ones need further tests? And the tests that we do are fairly non-invasive to start with. So
cancer is one of the deadliest cancers in Taiwan. With the signs very hard to spot before it's too late, it has a poor survival rate. Doctors say a little knowledge can go a long way towards improving treatment outcomes.
This cancer patient couldn't hold back her tears when thinking back to her diagnosis. She and Ms. Hung, another patient, had been diagnosed with diffuse gastric cancer 3 years ago.
There were 6 physicians who said I only had 3 to 6 months to live. They didn't even propose a plan for my treatment.
After medication failed to improve their condition, the patients turned to an alternative treatment called biodirectional chemotherapy. The treatment involves heating medication and injecting it directly into the stomach. It worked. Over time, the tumor shrank and eventually disappeared. 3 years later, the cancer remains in remission. But not all patients are so fortunate. Doctors say it's crucial to catch the early signs of the cancer, which can manifest as an innocent stomachache.
Most people deal with stomach aches by taking some antacid. That works fine if it's a simple inflammation. If the antacid doesn't bring relief, it's time to see a doctor.
Gastric cancer is among the top 10 causes of cancer death in Taiwan. It's important to know its milder symptoms so you can catch them before it's too late.